Hi, everyone. We are going to get started. And for today's webinar, we are practicing language justice to ensure that everyone has access to engage through the language they most feel comfortable in and most powerful in. So please choose your language by using the instructions on the next slide. So next slide, please.
I'm getting a
Vamos
message.
a,
Chat is disabled.
Sorry, I just enabled it, so you should now be able to use the chat.
Great. Thanks for
vamos,
adjusting. So
vamos
I'm sorry, go ahead.
vamos a practicar la justicia del lenguaje en este espacio usando la función de interpretación de Zoom. Las instrucciones están en las diapositivas. Para ver las diapositivas en español, vaya a la barra verde encima de su pantalla y al lado en la parte negra donde dice View Options, marque hasta que se deslice donde dice diapositivas en español y ahí puede ver las instrucciones de cómo entrar a la interpretación en español. You can enable interpretation.
Yes, it's there. It started.
Wonderful, thank you. So just again, as everyone is joining, please introduce yourselves in the chat and go ahead and use instructions on this slide to select your language of preference. And we'll get started very soon. Great. Okay. Thank you so much for joining us. We are so excited to share this new research with you. And we have a full hour planned ahead, so I'm just going to get us started. My name is Purewal Boparai. I use she, her pronouns, and I direct the research program at Human Impact Partners. Before we get further along, I'd like to pause for a land and labor acknowledgement. I'll stop here for translation. And next slide, please. Thank you. So we want to acknowledge the many nations on whose traditional territory we are joining from. We acknowledge them as the past, present, and future caretakers of this land. We honor this practice to lift up the stewards of the land we occupy and acknowledge that these communities are still here and still leading our movements for justice. It is one way of showing respect and a step towards correcting the stories and practices that erase Indigenous peoples' history and culture. I am joining today from the lands of the Patwin people, which is currently or today known as Fairfield, California. We'd also like to acknowledge the Black communities and Black-led movements for justice that have flourished here. We all live in a country that was built on the forced labor and stolen lives of enslaved Africans and is deeply rooted in the systems of slavery, Jim Crow, mass incarceration, housing discrimination, and continued racial trauma and oppression. We acknowledge and lift up all people who unwillingly gave of their labor, lives, and homes in the development of what we now know as the U.S. And we acknowledge and lift up all of their descendants and those who continue to fight for freedom and justice in this country. And there is so much more we can do beyond acknowledgement, and we are dropping some links in the chat for you to check out. Next slide, please. For those of you who are new to our work, I'd like to share more about Human Impact Partners. Human Impact Partners is a national nonprofit public health organization in existence for almost 15 years. We utilize a multi-strategy approach to transform the field of public health to center equity and build collective power with social justice movements. Our housing justice program grew out of years of work and partnership with community organizers, and it is informed by local and national grassroots leaders and networks. Our specific strategies include changing the frame, which includes conducting research for campaigns and communicating powerfully about housing and health, as well as building a new base of support by convening public health as allies to campaigns. And finally, bridging public health agencies and organizers to build strong inside-outside partnerships to win structural change. Next slide, please. So here's an overview of our time together. So We'll have a short intro of Human Impact Partners and Right to the City Strategic Partnership. I'll present a summary of our research findings. We'll hear from Irma, a tenant of a corporate landlord, and then we'll cover our action agenda, which accompanies the report and entails actions that local government could take. And finally, we'll have a panel conversation with advocates in the field, folks who are doing the work from both the community organizing side and the local government side. Sorry. We are taking questions through the Q&A function, and we'll try to address those questions live through that feature, and we'll cover what we can through the panel. We might not be able to get to all of the questions, and we encourage conversation in the chat. Please be sure to select everyone to make sure that everyone sees your chat and not just the hosts. And now I'd like to introduce our colleague and partner, Tony Samara from Right to the City. Next slide, please.
Thanks. Everyone can hear me okay? All right. Hey, everyone. So I'm Tony Samara, he, him. I oversee the policy and research work at the Right to the City Alliance. And I've also been supporting the Alliance in integrating climate justice into our land and housing work over the past couple of years. Before joining Right to the City staff in 2021, I worked for almost 8 years here in the Bay Area, where I live, supporting the tenants' rights movement, and mostly working in the smaller cities and suburbs of the region. For folks who aren't familiar with Right to the City, we're an alliance of grassroots housing justice organizations across the country, and we work on everything from rent control campaigns to land liberation through removing land and housing from the for-profit market. Our members do this through a combination of traditional community organizing and power building, local and state advocacy, ballot campaigns, electoral strategies. And we have about 60 or 70 members across more than 25 states. So one of the important things that we've learned in this work is the importance of building coalitions, and that really doesn't matter what the scale of the fight is. In other words, whether it's local, at the state level, national, partnerships, coalitions, strong allies are all really important to success. When I worked on local campaigns here in the Bay in places where there wasn't really a very long tradition always of organizing renters or even community organizing, period, I saw how important it was to build these kinds of relationships. We also know that one of the major impacts that insecure housing has is on health. So partnering with local health agencies and allies became a key part of our strategy in a lot of the campaigns, really from day one. And the value of these partnerships ranged from providing technical support, research, testimony at public hearings about the impacts of insecure housing on health, and also working together on community education through workshops and other kinds of community-centered events that really brought that lens and that framing out into the broader public, into the media. We are really lucky here in the Bay, I think. I feel like we have a lot of really great county health departments, and I've personally worked with a few over the years on our tenant protection campaigns, and I've seen the value of this partnership in action. So Right to the City and HIP and our members have worked together now for a few years. This report puts this partnership in action on a national scale, and that allows us to unlock the power of the partnership across the country, with the focus remaining on the local and to some extent state level fights that our frontline members are engaged in. And again, I think the value here is in combining the energy, the strategy of grassroots organizations, and then combining that with the research and area expertise of the public health sector. That's allowed us to coordinate across geographies, meaning rolling this out at the national scale, which then allows us to ID best practices and just generally, make the work more efficient and more effective in terms of how we partner and how we roll out these campaigns. I don't have to, tell any of you, the need for this continues to grow. Displacement is still a major threat, whether it's a form of evictions or increasing rents. Displacement is still a major threat to housing security and to community and individual health. That day-to-day insecurity, whether it's the fear of eviction, the fear of your kids getting sick from mold, that kind of insecurity continues to haunt renters across the country. And the challenge grows. More and more speculative capital is coming into the housing sector because for the market, houses are real estate, they're not homes, and real estate is profit. So I'm really happy that we're able to be part of this important report and to talk about all the ways that we can use it to build real community power and stability. And with that, I'll turn it back over to you, Suk.
Thanks, Tony. And it's so great to partner with you all and be working together for so many years. Our research report could not have been possible without Right to the City and without the project's 12 advisors. And we extend our deepest gratitude for them. They both shaped the report and also reviewed it and gave us feedback. We're also grateful for the community organizers, tenants, and residents who shared their stories with us. And we build this report from an already existing and solid foundation of research that has been conducted by other researchers and advocates documenting the harms of corporate landlords. We contribute to this body of knowledge by explicitly making the connection between corporate landlords and public health outcomes. And we also call for local government action, including public health. Our research methods rely on a mixed methods approach. So we conducted interviews, a focus group, we analyzed data on housing code violations, and we conducted a comprehensive review of the literature. We focused our primary data collection efforts in specific cities in Los Angeles, in St. Louis, and in Boulder. A question that comes up is, who are corporate landlords? And so we define them as others have done in the field. We utilize data from the U.S. Census Bureau's Rental Housing Finance Survey to group rental property owners who utilize and benefit from corporate structures into one category of landlords. And sometimes they're called institutional landlords. So corporate landlords own about 45% of rental housing units, and their share of rental housing units has been increasing over time. Corporate landlords operate in every state and across state lines. They're especially concentrated along the Sun Belt, owning multifamily housing, manufactured home communities, as well as single-family homes, and also targeting Black, Latinx, and low-income communities. Private equity is a special class of corporate landlords with heightened profit motivations. And we do dive into the specific strategies of private equity in this report. We also compare corporate landlords to small or mom and pop landlords, and research shows corporate landlords are more egregious or aggressive in their business tactics. So that includes around rent increases, eviction practices, and general inflexibility with tenants. In the US housing system, housing is a commodity for profit and is rooted in foundations of colonization, land theft, slavery, and neoliberal economic policies. Corporate landlords take commodification to a new level when they extract as much profit as they can through their business practices, which subsequently affects the lives of tenants who make up a growing percentage of our society and are disproportionately communities of color and people with low incomes. So in our research, we developed a framework of 6 strategies that corporate landlords use to seek profit and harm health. And these strategies are often applied together. They are drivers to houselessness and poor health, and they also deepen racial inequities. And I'll be going through each of these strategies over the next couple of slides. Next slide, please. Thank you. So residents of corporate landlords and private equity firms have been documented to endure a multitude of poor housing conditions. In this first strategy, where corporate landlords neglect upkeep. And some examples include faulty plumbing, mold, insect and rodent infestation, structural and electrical hazards. And these have potential to lead to injuries, also respiratory issues, and of course, stress and mental health impacts. Sometimes tenants are forced to address these issues on their own or wait it out. In either way, they're exposed to worsening health impacts. Research shows that corporate landlords commit a greater proportion of housing code violations. For example, in St. Louis, out-of-state landlords, who are typically corporate landlords, have a greater or higher rate of housing code violations. It's important to know that housing code violations reported to local government agencies are often underreported. And that's because tenants are fearful of reporting issues due to threats of eviction and harassment from landlords or property managers. And among immigrant communities, there's the added threat or fear of deportation or communication with ICE. Next slide, please. In the second strategy, corporate landlords file evictions aggressively. And so corporate landlords are more likely to engage in this practice called serial eviction filing, which is filing against the same household over and over. And they also file for eviction at greater rates than smaller landlords. Eviction can be really expensive for tenants, and it increases monthly costs by as much as 20%, according to research by Eviction Lab. These landlords also file disproportionately against Black tenants, including during the COVID-19 pandemic. Eviction has significant and serious long-lasting effects, and there's been more and more research coming out on this particular link. In one study shows that 1 in 4 children from low-income households will experience an eviction event sometime before the age of 15. And pediatricians consider eviction a perinatal, pediatric, and adult health concern. Next slide, please. In this third strategy, corporate landlords hike up rent and charge ancillary fees. So corporate landlords raise their rents continuously as much as they can, and sometimes also engage in AI and price setting softwares to inflate rent costs. As a result, also to mention, these landlords also tack on various new fees, including ones that tenants or residents were not familiar with or had not been paying previously under different ownership. And so, so residents are often forced to neglect other needs, other basic needs, in order to pay for housing costs.
Hey, Suk, I'm sorry to interrupt. We're getting a message from interpreters for you to please slow down.
Okay, thank you for that reminder. So some examples of where people have to sacrifice their basic needs are when they have to forego or cut back on their medication, or even when they have to cut back on food. And so there are examples of this in our report, many stories from interviews we conducted. And generally similar to the other strategies that I've mentioned, rent burden is also associated with poor health and stress for people and for their families. Next slide, please. So in this next strategy, corporate landlords evade taxes. And so these landlords have tremendous means to be able to avoid paying taxes at local and state and federal levels. For example, they utilize their legal resources to appeal property taxes and might also even, as in some cases, which has been shown, evade building permit fees. And so this is problematic for public health because oftentimes these local fees or taxes support local functioning for public health, public education, and other public goods. In addition, in the community settings where corporate landlords are operating, such as in apartment buildings or manufactured housing communities, they might remove amenities on the properties. And that is problematic because it removes opportunities for people and neighbors to have social cohesion and connection, which we know is important for health. Next slide, please. So in this fifth strategy, corporate landlords dodge accountability. So corporate landlords utilize the LLC structure, and they own many properties under various LLCs, sometimes tens, hundreds, thousands. And there's research that shows that the LLC structure is associated with habitability issues. Also, this structure makes it hard for government agencies to identify bad actors and hold them accountable for habitability issues. And so when government can't do their job in protecting communities and holding these landlords accountable, residents and tenants will endure the poor housing and health conditions. Next slide, please. In this sixth strategy, corporate landlords wield vast influence over policy and undermine democracy. Real estate is the largest lobby in this country, and through lobbying power, corporate landlords hold positions of power across local, state, and federal levels. And there's also been research that indicates that decision makers are also landlords, as much as 25%. These so policymakers and corporate landlords can rig policies in their favor. Landlord associations are also made up of leaders from corporate or private equity firms and not the small or mom and pop landlords that they claim to represent. Research shows that places with high eviction filing results in lower voter turnout, which is a threat to democracy. The landlord-tenant relationship is rooted in a differential power imbalance. At the collective level and at the individual level, power imbalances create stress, which can harm and which has harmful effects on health and well-being. And our report has many powerful stories from tenants and residents, and one of those is Irma. So I'm really grateful for Irma to be here to share her story with us, and I'll pass it over to Irma. Next slide, please.
Buenos días. Buenos días. Mi nombre es Irma Fabián y vivo en un edificio de dueños corporativos por 24 años y soy miembro de SAGE. Para empezar, quisiera compartirles lo que realmente ha impactado negativamente a mi familia y a mí, tanto en nuestra salud física, emocional, como mental e higiénicamente. Tuvimos muchos problemas en nuestro apartamento con el moho causado por la humedad y fuga de agua en los techos, paredes y tinas del baño, al igual que en los fregaderos de la cocina. Las paredes descarapeladas, llenas de plomo, cucarachas, ratones, que eran otro problema que a pesar de que limpiaba, estos roedores entraban a mi apartamento, debido a que las paredes tenían hoyos que no lográbamos visualizar. También teníamos ventanas de vidrios quebrados que no servían, que hasta temor nos daba abrirlas para que no cayeran al piso. Teníamos lo peor en este caso, lo que nos pasó fue la infestación de chinches, algo que nos obligó a tirar muebles, colchones y ropa. Imagínense todo esto y con bajos ingresos donde podíamos estar compre y compre todo esto. Era algo muy, muy estresante, con tanta ansiedad y hasta el sueño se nos iba, ya que constantemente pedíamos estas reparaciones y arreglos a nuestros arrendadores, pero nunca tuvimos solución alguna. Ya que en el año 2014 hay algo muy importante, no era a mí la única que me pasaba esto, también a mis vecinos, era una situación muy crítica. En el año 2014, por tanta preocupación, tantos problemas que ya teníamos, y además con niños pequeños, decidimos pedir apoyo a SAGE para hacer estas quejas y reclamos, ya que solos nosotros era un poco difícil y no todos teníamos ese aprendizaje y esa sabiduría de saber que teníamos derechos como inquilinos. Entonces, con ellos hicimos esta petición por escrito, lo que nos provocó más intimidación y agresión por parte del corporativo y ocasionó más daños emocionales a nuestras familias. Logramos pocos cambios, lo que nos llevó a pedir mucho más apoyo a las organizaciones de SAGE unirnos a ellos para adquirir más solución a la mala condición de vivienda. Vinieron a fumigarnos en ese entonces, trajeron insecticidas que eran dañinos para nuestra salud. Entonces, y ya que este químico persiste por 6 meses aproximadamente, imagínense todo esto. Nosotros decidimos pedir apoyo a unas promotoras de salud de la Esperanza Community Housing, quienes nos enseñaron la importancia de usar alternativas no dañinas para nuestra salud y que nos deshagan de estas y nos prevengan, ¿verdad?, a no tener estos animales roedores. En cuanto al Departamento de Vivienda, nunca favoreció a nuestras demandas. Desde entonces, nosotros como inquilinos hemos estado en una lucha constante, yendo a organizaciones y con otras coaliciones en Los Ángeles para hacer valer nuestros derechos a la vivienda saludable, digna y segura, con más protecciones para inquilinos. Hemos logrado con esta lucha que pasara y mejorara el nuevo sistema de código de salud del condado, el cual no se ha llevado a cabo. Así que es necesario que implementen para que hagan inspecciones reales sin limitaciones. También que el Departamento de Vivienda haga inspecciones seguras y reales y exijan reparaciones eficaces. Se debe crear una ley o póliza urgentemente que limite la fuerza y el poder de los dueños corporativos que hacen todo tipo de intimidación sin consecuencia alguna. Solo piensan en sus ganancias económicas sin invertir en las viviendas que son su fuente y las usan como mercancía sin importarles el bien humano. Incluir que se responsabilicen del cuidado, de la reparación de sus edificios para evitar condiciones antisaludables donde se crea una grave crisis de salud pública. Los inquilinos también somos contribuyentes a la economía. Pagamos nuestro alquiler, no es gratis. Pedimos viviendas saludables, seguras y dignas de vivir. No hay excusas. Queremos viviendas justas para nosotros, para nuestros hijos y nuestros jóvenes. Gracias.
Thank you, Irma. That was really powerful, and we're with you in demanding just living. Hi, everybody. This is Will Dominie. I'm the Housing Justice Program Director here at HIP. I supported Suk in the research, and then also alongside our advisors, developed the action agenda, which is a set of 5 actions that local governments should take to protect residents from corporate landlords and address the root causes of speculation. And the work that Irma and Sage is doing is featured prominently there, and they're real leaders in helping us move towards the kind of healthy housing that we all need. Next slide. I want to just start with a personal story because this is personal for me, like it is for so many of us. When my child was 1 year old, they told us that Ellie had high lead levels in her blood. And I have never been so scared in my entire life, like knowing what the lifelong impacts of lead poisoning can be. And her lead levels are back down. She's okay. She's doing great. And I think there's 2 big reasons why. The first is that we had power over our living situation. At the time, I was living in my mother-in-law's house. It was the depths of COVID. And some might put their in-laws in the same category as corporate landlords, but not me. Marta's super nice. Shout out Marta. And we were able to find the sources of lead and deal with them. And we had the power to change our living situation, to take the actions that we needed to ensure her safety. Some of the same things that I'm hearing Irma say she didn't have the power to do without the help of Sage and her neighbors. And this is a theme that you'll hear throughout the action agenda, because the truth is most renters have very little power over their living situation, and it's getting a lot worse under corporate ownership. The second thing I had was supportive local government. After that period, I came back to Oakland and ran into Alameda County Healthy Homes, Larry's staff, you'll hear from Larry in a little bit, at the hardware store. And I started talking with them, and Sue had one of their staff, Kim, out at our house doing a free assessment for lead hazards. And that assessment allowed me to finally calm down and understand that we could make our house pretty safe, pretty easily, and that Ellie was going to be okay. Kim was also just incredibly helpful and dedicated and engaged. And when I complimented her on her work, she brushed it off. And she said, basically, that's just what we do. We help our community because we also live in the community that we serve. And as we conducted research for this report, we heard a number of these kinds of stories of local government workers doing everything in their power to protect the people in their communities, sometimes doing things like paying for repairs out of their own pocket. And this is the tradition of public health and local government that I'm proud to be a part of. And it's this tradition of public health that we're speaking to in this action agenda that I'll talk about today. It's written for everyone working in local government who's dedicated to ensuring that our communities have what they need to thrive. That includes staff like Kim, folks who lead departments like Larry, and also the elected officials who set policy. Next slide. So I'm going to come back to power, because the landlord-tenant relationship always has a power imbalance, right? The threat of eviction can loom large. When someone has that much power over you, it can be really scary. It can really color the relationship. But corporate landlords take this to a whole new level. What power does one person have compared to a multinational corporation that can arbitrarily raise your rents, that can blow off code enforcement officers, and even use their wealth to block policies that keep renters safe? So this action agenda differs from some of the other policy documents that you'll see out in the world, and also from some of the traditional healthy housing work that we've done in public health, by saying essentially that tenants will only be safe in their homes when they have sufficient power as individuals and collectively. I want to pause and just say that again. Tenants will only be safe in their homes when they have sufficient power individually and collectively. Anyway, so you'll see recommendations that reflect that as we get into the action agenda. Next slide. This work of protecting our people requires all of us, and we're specifically suggesting roles for people working within government and organizers working outside of it. And I've worked in both places, and in both places I've seen a similar dedication and a willingness to serve, a willingness to protect our people, but both different strengths and different roles in each of those kind of categories. For folks on the inside, we're really calling on you to change practices, change policies, and for folks on the outside to work with tenants to identify issues, identify solutions, and then build political will. And just to say, some of the things in this action agenda are not easy. They're going to take a huge amount of power. If we move beyond Band-Aids, it's going to take a lot of power to really implement these things and get to them at their root. And that's really something that we have to look to the community organizers in the room for. Okay, next slide. So I'm going to get into the various actions here. There's 5 different actions that we're suggesting, and each of them have tools that accompany them. The first is really around transparency and data. We need to increase ownership, transparency, and data access. This is basically lists of who actually owns housing. Landlords, as Suk said, have been very successful in hiding behind LLC structures. Licensing also allows you to set standards and say, if you're going to do business in this, in our city, we actually expect you to, remedy those code violations, pay the fines that you owe, et cetera. So you can actually set some standards. And you could also use licensing to limit the number of homes that a corporate landlord can own in a given community. Next slide. We also need to keep residents safe in their homes. This is kind of a no-brainer, but traditional healthy housing tools are being challenged by the amount of power that corporate landlords have. They just have too much power. And some of the tools like complaint-based code enforcement. So this is where a tenant would have to call someone like Larry or Kim to say, hey, can you come to my house and do an inspection, can really expose tenants to retaliation, right? The things that Suk was mentioning of like, maybe they'll call ICE, maybe they'll evict you, maybe they'll raise your rent. And so we're suggesting proactive, powerful code enforcement that's designed to not displace tenants. We're calling for integrated programs to upgrade homes. And we're calling for work across departments and then between departments and organizers and lawyers to make sure that tenants are getting what they need to stay safe. Next slide. We also need to protect tenants from retaliation. We've been talking a lot about power, and here we're starting to get really, really into power. We need protections for tenants who report hazardous conditions or organize. That's anti-retaliation policies. Anti-harassment policies take that a little bit further and protect tenants in general from landlord harassment. And then we need broader foundational tenant protections like just cause eviction, right to organize, and rent control, so that tenants have a basic level of stability from which to advocate for healthier conditions or just enforce the rights that they already have. And then finally, we need to change our governance structures. These are things like housing commissions or rent boards or planning commissions, so that they're not just dominated by the landlord lobby and tenants are actually represented. Next slide. So now we're really starting to get into the root cause stuff that requires a little bit more political will, a little bit more power. But we can pass all the protections that we want, but as long as our policy choices encourage speculation and profiteering, we're going to be fighting an uphill battle. Our research identified many instances where tax dollars are directly subsidizing corporate landlords, even as they pursued mass evictions or refused to make repairs. And I think it's a pretty basic argument to say that public dollars and public resources should support public priorities and public health. And then we can also make similar changes in our tax policy to make speculation less profitable. Next slide. So this is another root cause. I think most of us can agree that unless we judge success based on Wall Street profits, there's something broken with our housing system. The federal government has defunded and intentionally discredited public housing. Market rate developers are focused on building luxury housing that none of us can afford. Corporate landlords are starting to buy up the subsidized housing that we have, often with disastrous implications for tenant health, as you can read in the report. But across the country, there's a rising focus on housing types that are permanently affordable and community controlled. This includes land trusts, actually resourcing public or social housing to be high quality and green, resident ownership in mobile home communities, and other options. And the health sector is already starting to understand the benefits of these options and invest in them. So that's the last of the strategies at the local level. I would say in the action agenda itself, there are also some strategies at the state and federal level, and we certainly need state and federal action as well. There is a lot in this action agenda, and there's also a supplementary resource that has examples and further reading. So there's a lot there. We hoped to kind of design it in a way that you could find the things that you're interested in and then get enough sort of breadcrumbs to start pursuing those, figure out where the resources are to move it forward. And we'd love to be a resource for you. I would love to take your call, answer your email about how to move these things forward. All right, next slide. So we're going to transition a bit about into what this work looks like in the real world. And I've invited two of our research advisors to join us to talk about the tools that they're using to challenge slumlords and secure healthy housing and racial justice. And they're in two very different roles, but I think they both exemplify the kind of dedication and the creativity that we really need in this moment. And they've also been really exceptional in building collaborations across departments within local government and then between local government and tenant organizing. And in short, they're doing the exact kind of work that we lift up in the action agenda, which makes sense because they heavily informed it. So let's hear from Sunny and Larry. Sunny is the co-founder and fund development manager at Tenants Transforming Greater St. Louis. You might have known them as Homes for All St. Louis. They just recently changed their name. And then Larry Brooks, the director of the Alameda County Healthy Homes Department. So let's move into our panel. I'm hoping that each of you can tell me a little bit about where you work, your role, and then how you're seeing corporate landlords and slumlords impacting health and racial equity. Maybe first to you, Sunny.
Hey, everybody. Like Will said, co-founder and fund development manager at Tenants Transforming Greater St. Louis. In my role, mostly I do the fund development. So I'm the one writing the proposals and doing the grants, managing those. However, recently we took on a campaign that was a part of our 10-year strategic vision when we started in 2018. And part of that was to address code enforcement for occupied properties. During that time, when we started as Homes for All St. Louis, I had a bed bug infestation in my apartment and tried to address it first through my landlord, who blamed everybody else around me, claiming that the woman downstairs was nasty and stuff like that. And so little did he know that we were communicating with one another and showing each other receipts. And we had to look at like what our options were. So we thought about like, do we, try to find another place to stay? We had limited options based on our income and then like availability of units at our income level. And then who got first and last month's rent and security deposits and application fees? Not I, said the cat. So we decided to stick it out together, organize together, and made specific requests to our landlord, and let him know that if he did not make the updates, then he would not be getting rent from us. We also at that time reached out to our local, we call it the Citizen Service Bureau, so it like directs your call to the proper department for it to be addressed. So we reported what was going on in our apartments, and when the health department showed up, they actually didn't schedule an appointment with me. They just called me and said, I'm like 30 minutes from your house. Can you come, and open the door for me? I was at work and I didn't have a car. So I had to find my way back to my home to open the door for the health inspector. Upon my arrival, the health inspector, identified, went and did their scan and then left with my landlord, and I never heard back from them after that. So for us, trusting local government, was difficult. But with our current code enforcement work, we knew this was one of the issues that we had to address, because there has to be an entity that holds these relationships, the way that these homes are supposed to look, that there needs to be someone or something that holds them accountable. And we have to have like trust in them, right? So crazy enough, we partnered with the department, with our buildings division, signed an MOU to address code enforcement and kind of revamping the system, identifying pain points and inefficiencies, and seeing where those are showing up, to come up with some better solutions so that what happened to us years ago, 6 years ago, doesn't happen again. So that's a little bit about what I do. I facilitate the coalition of partners. It started off with just like the buildings division, the vacancy collaborative, and Tenants Transforming Greater St. Louis. It was us three. And then I had to put on my organizer hat, and I went and start pulling other stakeholders into the project that touched code enforcement. So we recruited residents, both renters and low-income homeowners, stipend them to be a part of the process. We reached out to our city councilor's office, specifically problem properties. They're the ones that usually file suit against those property owners. We also included our health department and St. Louis area on agency. We also even included affordable housing developers in some of those like target neighborhoods on the north side and on the south side. So I'm the one that usually pulls all those people together so that we can be like, okay, what's the problem? How do we address it? Let's do the research. And then now we're moving towards implementation of a lot of those recommendations that we came up with. And so I'm gonna be here sticking it out with TTG STL and sticking it out hand in hand with our government partners. Can you believe it? I'm saying that we have government partners. That's weird. But we have to if we're gonna address it, because the problem is that big.
And Sunny, I've been so impressed with the way that you have kind of coordinated this broader group of organizers, tenants, and government partners, united around a vision really of like housing justice and also racial justice, and have really foregrounded those, I think, for the whole group. Like that is very present and clear in those meetings. And I think in the work that's coming out of them, right? So it's been really exciting to watch your guys' work.
Yeah,
Larry, oh, go ahead, please. Yeah.
yeah, we and people have asked like how have you been able to do that? Because people usually see grassroots organizations and government entities as like adversarial towards one another. And when we started, I had when TTG STL identified who those stakeholders needed to be. I sat down with each and every single one of them. I did one-on-one. So for my organizers in the room, you have to sit down, identify what people's self-interests are, and you make that ask based on what their self-interests are. And you usually, as an organizer, you go in knowing this is the role that I need you to play. So we always task. What we call tasking our allies is what our executive director, Christian Blackman, always says. We task our allies. We plan and we organize with our members, with our base, but we task our allies. So I did individual one-on-ones with every single person, both the leaders of the organizations or departments, had them, and my ask for them was like, you need to have at least one person with some authority to serve in this coalition. Additionally, when we came together, we agreed on what our values and principles were. So that was first and foremost. And to think, you would be surprised, but in that same space, government actors, homeowners, affordable house developers, we're saying the same things. We want equity. We want to reduce environmental harms. We want to reduce the social harm. So we were saying the same things. We ultimately wanted the same outcomes. And then we also developed a decision-making model. So, and crazy enough, everybody was like, wanted consensus. That's not something you would commonly see, but in grassroots organizing, we do some consensus, but everybody wanted consensus. And we also, when it came to like carrying out the work, we organized in committees, and we gave those committees the authority to make decisions on behalf of us, on behalf of the whole group, as long as it was rooted in those principles and values. So that's a little bit of what we did. And regular maintenance of those relationships are important. So I always try to create opportunities for us to come together and see each other as humans, and for us to like get grounded with one another and check in on us as, as the person first rather than the position.
Thank you, Sunny. I think there's so much to learn from in the work that you're doing. I want to bring Larry in, and Larry, can you actually speak to the same thing of just like, what's your role, and then how are you seeing corporate landlords and slumlords impacting health? And and also I think you can start getting into like, what are you doing about it? What's effective? What's useful?
That's where I have to laugh a little bit when I heard Sunny say, "Can you believe it? I'm working with government," because I've been following the chats and answering some of the Q&As, and rather than speak from my planned remarks, I'm going to tailor my response based on what I'm seeing in those chats and in those Q&As, and simplify this to, as the director of Healthy Homes, which started 30 years ago as the Child-Led Poisoning Prevention Program and then grew. And at that same time, I was growing as a code enforcement officer, having to deal with slumlords and corporate landlords. I think the solution can be pretty much drawn down to a couple of things, which is we have to preserve existing affordable housing, and the only way you preserve it is through routine inspection programs. So I'm a big proactive rental inspection program advocate, but I also recognize the dangers of displacement. And so you have to do it in combination with tenant protections. One of the other things we have to do, and that's where, Sunny, this is my moment. I can't believe it that I'm saying this, but we have to try to partner with landlords, as somebody who has fought them for 3 decades. In particular, the mom and pop landlords who are oftentimes property rich but cash poor. And so it's easy for the corporations to come and snatch properties away from them. And that takes away the opportunities not only for affordable housing, but for us to have people locally that we can work with because we know that oftentimes the corporations are headquartered outside of our state, and then we have to go chasing after them. They're hidden as limited liability corporations, LLCs. And that's where we also have to partner with a lot of tenant advocacy groups that can go to our state legislature and, like Rise Economy, push for Senate Bill 1201, the LLC Transparency Act. And so the California Healthy Housing Coalition, we are a group of tenant advocacy, government agencies, and nonprofits that have also gone to the legislature to push for integrated pest management, lead poisoning prevention, mold, asthma reduction. You got to get organized. A landlord even told me that once. He said, I don't see what the problem is. You guys outnumber us. There's more of you voting than us, but we always seem to get what we want. So coming from Oakland, where our department was built by people united for a better life in Oakland, I wouldn't have a job if not for that advocacy group. They grew out of the Black Panther Party, which was the first in the nation to do free breakfast programs and to do sickle cell testing and lead poisoning testing at health fairs. I'm a strong believer in advocacy. I really believe you got to do it at the grassroots level. You got to show that you can build up the political will to get what you need to take on the corporate landlords. And I'll leave it at that.
Thank you, Larry. That's so powerful. And as I was thinking about the prep for this panel, I was thinking about kind of like what special unicorns you both are in terms of working outside your traditional roles. I mean, I think as someone who's worked in local government, advocacy should be considered part of our traditional role, especially when it's advocating on behalf of the health of the folks that we're working with, but it often isn't. And Sunny, similarly, I think you're very much stretching kind of the traditional organizer role in convening this whole like multi-organization, multi-departmental crew to really address housing issues. So anyway, just to say, like, I think that's part of what makes like the special sauce of both of your guys' as work. Do you have other suggestions on what you think works? Or like specific kinds of policies that you're excited about and are trying to push forward at the moment?
Yeah, it's funny that you bring it up about the kind of stretching outside of our traditional boundaries. So to break down like the code enforcement work that we're doing, it's we titled it "Home is Where Our Health Is," actually inspired by Human Impact Partners and the work that they were doing in Minneapolis. Like, we all aspire to be like Minneapolis. And we basically process mapped the code enforcement process for occupied properties with the buildings division and with the Department of Health, because they have two separate processes. And then we went in and identified pain points. With the help of HIP, we also did a full review of the literature and the data that we had available. So health data, housing code violation data, and demographic data, and kind of layered that on top of each other. The initial hypotheses that we had were true. We found that where those housing code violations were more prevalent is also where you had larger populations of Black folks, larger populations of, instances of poverty. And, it's silly to us as the organizers because this is our story and we know it and we've been telling it. But sometimes it takes a report to validate it for a number of people. And then from the report that we got, we started looking at what can we do? What are our solutions? What are recommendations to kind of solve these little pain points within these processes? The major like foundational recommendations that we came up with, one was a rental registry. We were finding that inspectors would start the process of trying to reach out to the owner, reaching out to the tenant, but didn't have a contact. And they would have to do the research themselves. they're not researchers. You know, they're inspectors. Their job should be to observe and document. So what we're seeing is that, so rental registry, and we passed that in December of 2023. We also had some simple administrative recommendations, like send a letter of violation to the tenant so that they know what's happening on their property. Because our tenants weren't knowing until the house was being condemned and the notice was slapped on their door. And then relocation assistance to be offered. We actually passed this. This is the Impacted Tenants Fund. $100,000 of ARPA fund will be allocated to it. And then we're advocating for more as well come the new year. So those are some things that I'm excited about. And there's so much more down the pipeline. But I'll pass it to Larry.
Thank you, Sunny. And also just to say, I'm seeing as an audience question, how can stakeholders work to improve conditions and housing equity when our legislators control state landlord tenant law, and landlord and real estate interests are so strong there? Larry, feel free to talk to that. And I would also just say that is one of the recommendations in the state and federal part of the action agenda is directly challenging some of the preemption. The landlord lobby has been incredibly successful in using preemption at the state level to block local action. But anyway, over to you, Larry, and maybe just take 1 minute, and then we'll use our last minute to close.
Yeah, public shaming is my quick answer to that. And I believe that applies to building inspectors and code enforcement officers that don't do their job as well. You know, that's part of the reason why I'm so big on advocacy and building up that massive political will. Because, yeah, we know that there are judges and there are legislators that own rental property. And so they're going to side with landlords. But there are also elected officials out there that aren't necessarily going to side with the landlords, but you got to give them the education and the motivation to pass policies that will support what it is that we are about. As my political consultant said, the #1 goal of every elected official is first to get elected. Their second goal is to get reelected. And that's where your voting power comes into play.
Thank you, Larry. I think that's a great note to end on. I want to thank everybody for helping to put this webinar together, especially Suk for anchoring the research that you'll see, and all of our advisors, including Sunny and Larry, for really helping shape it and put this direction in a good direction. We're going to drop in the chat the links to the report and action agenda. Please take a look. Let us know if you have questions. We'd love to talk with you about it. And everyone will get the recording and the slides, so don't worry about that. I think with that, we are going to close. Anything else? HIP staff? Larry and Sunny? Okay. Thank you so much, everybody. Thanks for joining us today. And we look forward to working alongside you to win health and housing for everybody in this country. Bye.